So, good day, everyone. This is our research proposal entitled Descriptive Study about Inconvenience of Filipinos Leading to Disobedience of the Pandemic Protocols. Members Jevan Edric Abiado, Cheryl Denise Alashan, Danica Daniel Peremne, Janessa Maria Angela Solania, Daniel Patricia Valenzuela, and myself, Shalo Bisoliano. Chapter 1 Introduction. Background of the study. In December 2019, the coronavirus disease, or COVID 19, is an infectious disease caused by a new strain of coronavirus. During his meeting with the cabinet members, President Duterte ordered Interior and Local Government Secretary Eduardo Año to supervise local chief executives in carrying out health protocols such as mask wearing, observance of social distancing, and encouraging people to stay indoors. 91% of Filipinos always wear masks when they leave the house, according to a survey recently released by YouGov in partnership with the Institute of Global Health Innovation at Imperial College London. The survey added that only 1% of Filipinos do not wear masks at home or outside their homes. While many people comply with advice to wear masks, these are not worn properly. Sometimes the mask is under their nose or chin, or it is loose fitted or tight fitted. The N95 masks are single use only, especially the surgical masks, and should not be washed because its filtering mechanism will be destroyed. But Filipinos have the habit of using single use items more than once, so using a single use mask will defeat its purpose of wearing one. Preventive measure is most difficult to comply with its social physical distancing. People have the tendency to come close together, especially when you can hardly hear each other because you are wearing masks. Officials have blamed violators of quarantine measures for the spike in infections and have vowed to intensify the implementation of localized lockdowns, testing, and contact tracing efforts along with the treatment of those infected.
Objectives of the study. Specifically, the study aimed to determine the following: to determine the inconvenience as a factor of disobedience among Filipinos, to determine the effects of disobedience of pandemic protocols towards the health of Filipinos, to determine the factor that causes the disobedience of Filipinos. Significance of the study. The study aims to further understand the disobedience of Filipinos when it comes to wearing their mask, which could be beneficial to the following: Filipinos, Department of Health, the government, and the future researchers.
Scope and limitation of the study. The main objective of this research study is to determine inconvenience as a factor of disobedience among Filipinos and to find out the factors that causes the disobedience of the Filipinos. The study will not cover other problems that are not considered as related to the inconvenience as a factor of disobedience among Filipinos. The respondents will be the grade 12 senior high school students who are living in Iloilo. We can only survey grade 12 students because they are the most accessible samples for our research since they are technologically related. The study duration is of data collection starting from the beginning of data collection till end. The study may be considered started as soon as the first lap of the study starts. The study would be done through the utilization of questionnaire or Google Forms to the students as a survey and as a reference. By their answers, the researchers will be able to determine the factors that cause the disobedience of the Filipinos. Although the research reached its aim, there were still unavoidable limitations since we are conducting the study during the pandemic and we are observing the protocols. One is the inability of the researchers to conduct face-to-face surveys due to the pandemic. Therefore, researchers will have difficulty in gathering the data needed due to slow internet connections and the distance among the research members.
Definition of terms. Centers for Disease Control and Prevention. According to WHO, or the World Health Organization, the CDC website includes credible vaccine and immunization information and links to many resources, including patient education and training materials. The vaccine safety section is extensive and well organized. Many publications and resources are available at no cost. It is the branch of the U.S. Public Health Service under the Department of Health and Human Services charged with the investigation and control of contagious disease in the nation. Next, we have the medical protocol. The guidelines for medical care of a specified clinical situation based on patient presentation. That is a detailed written set of instructions to guide the care of a patient or to assist the practitioner in the performance of a procedure. Approved by the medical director and/or medical oversight authority of the jurisdiction. Preventive health measures. It encompasses a variety of interventions that can be undertaken to prevent or delay the occurrence of disease or reduce further transmission or exposure to disease. They are an important part of health promotion efforts and many have been recognized as a cost-effective way to identify and treat potential health problems before they develop or worsen.
Theoretical framework. There's an important effect of subjective in an individual's behavioral intention to follow the preventive measures of COVID-19. Attitude towards behavior refers to the realization of the individual performing a particular behavior. People having a positive attitude can comply with rules, requirements, and guidelines according to most studies. One of the recommended solutions for preventing the spread of the coronavirus with strong scientific evidence to support this is wearing a mask. In addition, wearing a mask is more adapted, easier to do, and less restrictive than quarantining and physical distancing. If more people had decided to always wear a mask, the whole world would have done a far better job controlling the pandemic. By Sanket Andavarapu. Individuals may purposefully disobey to not wear a mask to get their personal freedom. There are some reasons for many that do not to wear a mask. Other people experience wearing a mask is uncomfortable, which is it is difficult to breathe in, hot, sweaty, glasses fog up, etc. Others do not believe towards the effectiveness of masks. Others risk their own safety because they only believe that masks only protect the mask wearer. These rules may feel like, to some, a forfeiture of their freedoms. According to Stephen Taylor, a clinical psychologist and author of The Psychology of Pandemics, even the measures could protect them and for their safety, people naturally do not follow when they're told what to do. People value their freedoms, he added. When others trying to invade their freedoms, they became feel like they are bothered.
Conceptual framework, social factor, loss of job, decrease in salary, fares rising. Government's behavior, strict implementation of wearing face mask or face shield, limited number of persons inside buildings. Common causes of inconvenience, inaccessibility to face mask, inability to buy face mask, lack of knowledge. A proposed study of determining the inconvenience as a factor of disobedience among Filipinos.
Chapter 2: Review of Related Literature. According to World Health Organization, coronavirus is a contagious disease caused by a recently discovered coronavirus. To prevent the transmission of the virus, the best way is to be knowledgeable about the disease it could cause and how could the COVID-19 spread. By washing your hands or using alcohol-based rub regularly helps you protect yourselves and others from the infection. The Center for Disease Control and Prevention added the more safety precautions a family practices, the more safe they would be during the pandemic. CDC also stated that There are three more important ways to slow the spread of the virus, and that is by wearing your mask to help stop the spread of COVID-19 to other people around you, practice social distancing and staying at least 6 feet away from other people, especially in the crowded places, and always wash your hands with soap and water for at least 20 seconds or use hand sanitizers or alcohol with at least 60% alcohol to sanitize your hands. And according to International Development Law Organization, Filipinos who live below poverty line are more likely to be affected by COVID-19. This is due to the fact this is due to the lack or limited access to basic necessities such as soap, water, and face masks. They are also more likely to catch the virus because they live in overcrowded and close living residences, making the social distancing more difficult. YouGov and Institute of Global Health conducted a survey about the insights on face mask use. According to the survey, the most willing to follow the wearing of face masks are Vietnam and Philippines. The countries with least to wear face masks are Norway, Sweden, Denmark, and Finland.
Chapter 3: The Methodology. Research Design. This study will utilize the qualitative study, which is defined by Pollitt and Beck, as a naturalistic method of inquiry which deals with the issue of human complexity by exploring it directly. This study will utilize phenomenological method. This design aims to obtain description of the subjects or respondents' lived experiences through surveys and interviews. This design is fitted to this study because since the focus is on the psychological processes of a group of people in a community who wears their mask properly and practices social distancing, soliciting their personal views and perceptions relative to the queries the researchers will give them using Google Forms. Data collection. The researchers will be using Google Forms due to the protocols of COVID-19 pandemic wherein the researchers cannot conduct face-to-face surveys and interviews. Analysis of data. Percentage data including incorrect mask wearers, people recycling single-use masks, and people who do not practice social distancing will be passed and analyzed by a statistician. Analysis will be performed using Microsoft Excel.
Now moving on to the questionnaire. First question, do you wear mask when going outside? Second, when do you wear a mask? Third, do you feel safe when wearing a mask? Which type of mask do you wear? Do you make your own mask? If using a medical mask or surgical mask, do you change your mask daily? If using a cloth mask, do you wash your mask daily? Which part of your face do you cover with your mask? Do you experience difficulty in breathing when wearing a mask? Does your family conduct social gatherings? Do you attend social gatherings? Do you wear a mask when going around your neighborhood? Do you have difficulty in speaking to other people when wearing a mask? Does your glasses mess up when wearing a mask? Do you experience irritation when wearing a mask? Do you distance yourself from other people all the time?